Welcome back to Mangevity, where we dive deep into men's health topics that matter but don't get discussed enough. I'm Simon, and today we're tackling a question that probably keeps some of you up at night. Can low testosterone actually shrink your penis? It's one of those fears that floats around men's health forums and locker room conversations, but rarely gets a straight scientific answer. So today we're separating fact from fiction. We're going to cover what testosterone actually does for your penis, whether low T can cause shrinkage, what's really happening when size changes occur, and most importantly, what you can do about it. Quick disclaimer before we start. This is educational content based on peer-reviewed research and expert medical consensus. If you're concerned about your testosterone levels or sexual health, always consult with a qualified healthcare provider. All right, let's get into the science. What does testosterone actually do? First, let's establish what testosterone actually does for male sexual anatomy and function. Testosterone is the primary male sex hormone, produced mainly in the testicles. It's responsible for developing and maintaining male characteristics throughout your life. During puberty, testosterone is crucial for penile growth and development, testicular enlargement, development of the prostate gland, growth of pubic, facial, and body hair, deepening of the voice, increased muscle mass and bone density. In adulthood, testosterone maintains libido and sexual desire, erectile function and quality, sperm production, muscle mass and strength, mood and cognitive function. Now here's the critical point. Testosterone's most significant impact on penis size happens during puberty, specifically during the developmental window from ages 9 to 16 or so, when the penis goes through its primary growth phase. But once puberty is complete and you reach your adult size, typically by late teens or early 20s, the role of testosterone changes. In adulthood, testosterone maintains the health and function of penile tissue, but it's not actively causing growth anymore. Those developmental windows have closed. Think of it like building a house versus maintaining it. Testosterone during puberty is the construction phase. Testosterone in adulthood is the maintenance phase. So does that mean low T in adulthood can't affect your size? Well, it's more nuanced than that. Let's break down what actually happens. The truth about low T and penis size. Here's the straight answer. Low testosterone in adulthood does not cause your penis to physically shrink in terms of its structural size. Your penis isn't going to get shorter or permanently smaller because of low T. The truth about low T and penis size are: 1. Erectile tissue health and blood flow. Your penis has 3 chambers of erectile tissue called the corpus cavernosum and corpus spongiosum. These tissues are filled with blood vessels and smooth muscle. Testosterone helps maintain the health of these tissues. It supports endothelial function, the lining of blood vessels, smooth muscle tone, nitric oxide production, critical for erections. When testosterone is low, these tissues can become less healthy. The result: you may not achieve full erections anymore. If you're only getting to 70% or 80% of your maximum hardness, your penis will appear smaller than it did when fully erect. 2. Reduced spontaneous erections. Healthy men experience multiple erections during sleep. You might know them as morning wood. So these nighttime erections aren't just random. They serve a critical function. They oxygenate the erectile tissue, keeping it healthy and elastic. It's like stretching a muscle to maintain flexibility. Low testosterone often reduces the frequency and quality of these nighttime erections. Over time, without regular oxygenation and stretching, the erectile tissue can lose some elasticity. Again, this isn't permanent structural shrinkage, but the tissue becomes less pliable, and you may not expand to your full potential when aroused. No 3. Penile atrophy from disuse. There's a principle in medicine: use it or lose it. This applies to many body systems, including erectile tissue. Low testosterone often decreases libido dramatically. If you're not having erections regularly, whether from sex, masturbation, or spontaneous arousal, the tissue doesn't get the regular stretching and blood flow it needs. Studies show that men who go long periods without erections can experience some degree of penile atrophy, a reduction in both length and girth. This is particularly documented in men after prostate surgery or in those with severe erectile dysfunction. But here's the key. This type of atrophy is often reversible with restoration of normal erectile function. No 4. Fat pad enlargement. This is a big one that gets overlooked. Low testosterone is associated with increased body fat, particularly visceral fat, the fat around your organs, and the fat pad at the base of the penis, called the suprapubic fat pad. As this fat pad grows, it can hide a portion of your penile shaft, making you appear smaller. Your actual penis hasn't changed size at all. It's just being obscured by fat. For every 30-50 pounds of weight gain, you can lose approximately half an inch to an inch of visible penis length. This is completely reversible with fat loss. 5. Testicular atrophy. While we're talking about testosterone and size, it's worth mentioning that low T, especially when testosterone production shuts down due to external testosterone use, can cause testicular shrinkage. Your testicles can lose 10 to 30% of their size when not actively producing testosterone. This is actual structural atrophy, not just appearance. Other causes of perceived shrinkage. Before you blame everything on testosterone, let's look at other common causes of perceived or actual penis size changes. No 1. Aging. Even with normal testosterone levels, aging affects penile tissue. Collagen increases, elasticity decreases, and blood vessel function declines. Most men experience some reduction in erect size with age, typically a loss of about 1-2 centimeter in length between ages 30 and 70. This is normal aging, not necessarily a testosterone issue. No 2. Cardiovascular disease. Your erections are a vascular event. They depend on healthy blood flow. Conditions like atherosclerosis, high blood pressure, high cholesterol, and diabetes can all impair blood flow to the penis. Poor vascular health often causes poor erections before it causes heart attacks. Your penis is an early warning system for cardiovascular disease. No 3. Peyronie's disease. This is the development of fibrous scar tissue inside the penis, causing curved, painful erections. It can also cause loss of length and girth. It's not related to testosterone, but can co-occur with low T since both become more common with age. No 4. Medications. Certain medications can affect erectile function and apparent size. Antidepressants, SSRIs, blood pressure medications, some beta blockers, finasteride, Propecia for hair loss, anti-androgens. No 5. Psychological factors. Stress, anxiety, depression, and performance anxiety can all cause poor erections. If you're only getting semi-erect due to psychological factors, you'll appear smaller. No 6. Smoking and substance use. Smoking damages blood vessels and is one of the strongest risk factors for erectile dysfunction. Chronic alcohol use and recreational drug use can also impair erectile function. Romance anxiety can all cause poor erections. If you're only getting semi-erect due to psychological factors, you'll appear smaller. And the point here is, if you're noticing size changes, don't automatically assume it's just low testosterone. There are multiple factors to investigate, and addressing them holistically gives you the best results. Now we move towards testing and diagnosis. So how do you know if testosterone is actually your problem? Symptoms of low testosterone include decreased libido and sexual desire, erectile dysfunction or reduced erectile quality, fatigue and low energy, depressed mood, irritability, loss of muscle mass and strength, increased body fat, especially around the midsection, reduced bone density, difficulty concentrating, brain fog, and decreased motivation. If you're experiencing several of these symptoms, then we move towards treatment and restoration. The good news, if low testosterone has contributed to erectile dysfunction, tissue health decline, or fat accumulation, and you address the low T, you can often restore much or all of your functional size. No. 1. Lifestyle optimization. Before jumping to TRT, especially if your testosterone is borderline or you're overweight, lifestyle changes can make a significant difference. 2. Lose body fat. Fat tissue converts testosterone to estrogen. Losing weight can increase testosterone. Plus, losing the fat pad directly increases visible penis length. Strength training. Resistance exercise, especially compound movements like squats and deadlifts, boosts testosterone production. Sleep 7-9 hours per night. Most testosterone is produced during sleep. Chronic sleep deprivation can cut testosterone by 10-15%. Manage stress. Chronic stress elevates cortisol, which suppresses testosterone production. Limit alcohol. Chronic stress elevates cortisol, which suppresses testosterone production. Optimize nutrition for healthy testosterone. If you want to naturally support testosterone levels, nutrition is one of the most powerful tools. Your body cannot produce hormones properly without the right nutrients. Let's break it down. 1. Zinc, essential for testosterone production. Zinc plays a direct role in testosterone synthesis. Even mild zinc deficiency can reduce testosterone levels. Best food sources of zinc. Oysters, highest natural source. Red meat, beef, lamb. Chicken thighs, pumpkin seeds. Cashews, chickpeas, eggs, yogurt. Practical tip. If you don't eat seafood, combine red meat plus pumpkin seeds regularly. Daily requirement for adult men, about 11 mg per day. 2. Vitamin D, the hormone. Vitamin. Vitamin D acts more like a hormone than a vitamin. Low vitamin D is strongly associated with low testosterone. Natural sources. Sunlight exposure, 15-30 minutes daily if possible. Fatty fish, salmon, sardines, mackerel. Egg yolks. Fortified milk. Mushrooms exposed to sunlight. If blood levels are low, supplementation may help, commonly 1,000-4,000 IU daily, but blood testing is ideal. Mushrooms exposed to sunlight. If blood levels are low, supplementation may help, commonly 1,000-4,000 IU daily, but blood testing is ideal. 3. Healthy fats, critical for hormone production. Testosterone is made from cholesterol. Extremely low-fat diets can reduce hormone production. Best healthy fat sources: extra virgin olive oil, avocados, nuts, almonds, walnuts, seeds, chia, flax, pumpkin, fatty fish, salmon, hormone B, whole eggs, grass-fed butter in moderation, coconut in moderation. Moderate healthy fats help optimize hormone balance. 4. Adequate calories. Don't undereat. Chronic calorie restriction tells your body you are in survival mode. When calories are too low, testosterone drops, metabolism slows, stress hormones increase. Foods that help maintain healthy caloric intake: lean meats, whole grains, rice, oats, quinoa, potatoes, healthy fats, dairy, fruits. When you nourish your body with the right nutrients, you're not just eating. You're building the foundation for stronger hormones, greater energy, and a healthier, more powerful you. All right, let's bring this all together. Does low testosterone shrink your penis? The answer: not structurally and not permanently, but it can cause functional and apparent size reduction through poor erectile quality, not reaching full hardness, reduced nighttime erections, less tissue oxygenation, disuse atrophy, lack of regular erections, fat pad enlargement, hiding visible length, testicular shrinkage. Yes, this one is real. The good news: most of these changes are reversible when you restore healthy testosterone levels and erectile function. Final thought: your penis size is largely determined by genetics and puberty. Adult testosterone levels maintain function and health, but don't add inches. However, optimizing your testosterone can absolutely help you reach and maintain your full genetic potential, and that's nothing to overlook. If you're experiencing symptoms of low T, don't ignore them. Low testosterone affects far more than just sexual function. It impacts your energy, mood, muscle mass, bone density, and overall quality of life. It's worth investigating and addressing. Thanks for watching. If you found this helpful, hit that like button and subscribe to Mangevity for more evidence-based men's health content. Drop your questions in the comments. I read them all and often turn them into future videos. Remember, optimal health includes hormonal health. There's no shame in optimizing your testosterone. I'll see you in the next one.